All right, welcome to Dental Board Dental Exam Review. Um, Last time we reviewed the primary dentition, and today we're going to review some of the high-yield material on the tooth development and the dentin, cementum, enamel, and the pulp. Okay, so these are some of the high yield material which you should know before you go in the exam. Okay, so stages of tooth development, we discussed these in the primary dentition lecture. So we're going to review some of the key factors. Okay, so the first stage, as we mentioned, there are about at least four important stages that you need to know. Okay, the first stage is called the initiation stage, which starts about 6th to 7th week, and induction. During this process, the main process in the initiation stage is the induction process. Interruption in the initiation stage gives rise to anodontia, such a lack of teeth, or supernumerary teeth. You have extra teeth in the mouth. So the stage which somebody asks, okay, the patient has supernumerary teeth, which stage was affected or interrupted? It's the initiation stage. Okay. The second stage is the bad stage, which takes place around the 8th week, okay, in utero, meaning inside the womb before birth. And the main process during the bad stages usually is proliferation, so more growth, okay. The third stage is the cup stage, which starts in the 9th to 10th week in utero. Again, in utero, when I say in utero, it means before birth, okay? So you have to know different terms, okay? And the main processes of the cup stage is proliferation, differentiation, morphogenesis, okay? Meaning differentiation, the histology, as we saw in the previous lecture in the primary dentition, is that you have differentiation of the epithelium, okay, starting to invaginate, forming a cup-like structure, and this cup-like structure is going to further on invaginate and form something which looks like a bell, okay. And then morphogenesis, meaning it starts forming shapes. Now, when you look at the tooth, the shape of the tooth is formed by enamel, dentin, and cementum. During morphogenesis, definitely enamel and dentin start to form. So cup stage is key. All right, and interaction in this phase gives rise to densin dente. All right, make sure you know densin dente real well. Germination, okay, fusion, and tubercle. Tubercle is when there's an extra enamel like structure on the enamel. The cusp of carabelli sometimes looks like a tubercle, and the talon cusp also is a tubercle. It's an example of a tubercle. The fourth stage is the bell stage, okay, which occurs 11th to 12th week in utero. And the main stage in the bell stage is a histodifferentiation, morphogenesis, okay, and interruption in the bell stage gives rise to macrodontia and microdontia, okay. And the fifth stage is apposition. So you start depositing more of the dentin, more of enamel, more of cementum, okay. So deposition of dentin, enamel, cementum, and the pulp is the main process, and interruption is the apposition stage, usually gives rise to enamel dysplasia, concrescence, okay, which is like a hypercementation where the two roots are fused together by cementum, and also enamel pearls, okay, formed due to interruption in their position stage. So these slides, very high yield, make sure you know it really well. Stages of tooth development, the cap stage, bud stage, and bell stage. Make sure you review them. Okay. Now let's discuss about cementum. These are some of the high yield material on the cementum, the things you need to know. So the cementum is composed of mineralized fibrous matrix and cementocytes. Okay, these are the cells that actually make up cementum, or they produce cementum. The fibrous matrix of cementum has Sharpie's fibers, which are terminal portions of PDL. Okay, PDL again is a short for periodontal ligament, and you're supposed to know the PDL, the principal fibers of PDL. Cementum is like bone. Okay, it's bone-like mineralization. However, unlike bone, it is avascular, meaning it has no blood vessels and it has no nerves when you compare cementum to bone. Okay, and cementum is also acellular and cellular in component. Okay, so it has two components. Cementum has two components. It has acellular cementum, meaning cementum without cells, and then you have cellular cementum, which has cells, which has cementocytes. So the function of cementum compensates for occlusal wear by apical deposition. So if somebody wears off his teeth because the tooth has to be in occlusion, then you have the deposition of cementum on the apex of the root, causing it to passively erupt. And the deposition of cementum, so cementum protects the root from resorption during vertical eruption. Cementum differs from enamel in that cementum has collagen, okay, and cellular component. Cementum does not have any, enamel does not have any cells. Cementoid, so the term cementoid refers to uncalcified or immature cementum. Okay. So cementum is more resistant to resorption than the alveolar bone. That's why you're able to orthodontically move teeth without resolving the roots. However, if you apply too much force, of course, you're going to resolve the roots. However, cementum in general does not resolve, and it's more resistant than the alveolar bone. Primary function of cementum is to attach Sharpie's fibers. It's slightly softer and lighter in color than dentin. Cementum is produced by cementoblasts in the PDL. Okay, I put here not the pulp, so it's not the pulp that produces cementum, it is the PDL. The PDL is the one producing cementum. Okay, and the cementoblasts are found in the PDL and they deposit cementum. Cementum develops from dental follicles in the dental sac. The thickest cementum is found at the root apex, and it is thinner near the CEJ, cemento-enamel junction. Cementum is acellular and cellular, as I mentioned before, and So the acellular cementum is referred to as primary and secondary. Okay, so the secondary is the cellular cementum. The cementum, the acellular and cellular cementum, they have no functional differences. Okay, so let's look at the comparison of acellular versus cellular cementum. The acellular cementum, in the acellular cementum, the first layer of cementum is found at the dentinoscemento junction. Okay, dentinoscemento junction, this DCJ, is where you find your first layer of acellular cementum. Acellular cementum is formed at a slower rate. It also has no embedded cementocytes, hence the name acellular. It predominates at the coronal 2/3. So where you find most of the acellular cementum is at the coronal 2/3 of the root. It is thinnest at the CEJ. Now let's look at the cellular cementum. Cellular cementum has a layer of cementum laid over the acellular cementum. Okay, so acellular cementum is the primary cementum, the cellular cementum is the secondary cementum, and this cellular cementum is laid over the acellular cementum. The cellular cementum is formed at a faster rate, and it has cementoblasts. Okay, now where do you find most of the cellular cementum? Is found at the apical 1/3 of the root, and this is the one which I mentioned before. It compensates for the occlusal wear. Okay, make sure you know the difference. High-heeled slide here. Dentin. Okay, so you cannot go in this exam without knowing dentin. So we have different types of dentin, okay, which we are going to discuss. So the reparative dentin, or also known as tertiary dentin, is the dentin formed in response to injury. And what can cause injury, such as bruxism, okay, that's attrition, cavity preparation, cavities, even recession. That because recession causes sensitivity and injury, usually the dentin reacts and deposits more of a tertiary dentin. Okay, primary dentin. Primary dentin is the dentin formed before completion of the apical foramen. Before the apical foramen is completed, with whatever dentin is deposited, that's called primary dentin. Primary dentin has regular pattern of tubercles or tuberose. Okay. Secondary dentin. So secondary dentin is dentin formed after the completion of the apical foramen. So primary dentin formed before the completion of apical foramen. Secondary dentin is the dentin formed after the completion of the apical foramen. The secondary dentin is formed at a slower rate than the primary dentin. It is less mineralized. Okay, the secondary dentin is less mineralized compared to primary dentin. It is regular and uniform around the pulp cavity. Secondary dentin is made by odontoblasts in the dentinopulp interface. So the interface between dentin and the pulp, that's where the odontoblasts lie, and those odontoblasts are going to make dentin. The junction between primary and secondary dentin is characterized by sharp change in the direction of tuberose. Okay, that's how you know that's a junction between the primary dentin and the secondary dentin. Okay, there's a sharp change in the direction of the tuberose. Dead tracts. Now, what is a dead tract? The dead tract is an empty tubule, okay? So when dentin tubules are filled with air, are called dead tracts, okay? And sclerotic dentin. Sclerotic dentin is also a type of tertiary dentin. It is found between the dentin tubules and it prevents bacteria from entering the pulp. So dentin within the dentin tubules, okay, to seal it off and preventing the bacteria from entering the pulp. It appears dark, smooth, and shiny. Okay, that's how you know that's sclerotic dentin. Let's discuss enamel. So the enamel in the IEE, which forms the pre-ameloblast, okay? Pre-ameloblast induce the formation of odontoblast. Isn't that wonderful? So you have pre-ameloblast. You say, what do pre-ameloblast induce? They induce odontoblast. Once you have odontoblasts, the odontoblasts are going to form predentin. And then the predentin is going to induce formation of ameloblasts. Okay, so you have to have, because remember, you have to have enamels have to be laid over dentin. So once you have the predentin, that's when the ameloblasts are formed, so they can start layering the enamel. Okay. And so the ameloblasts usually they have these what we call Tom's processes. And these Tom processes are usually just ameloblasts which are aligned. Okay. So what are Tom's processes? They are ameloblasts. And that's going to deposit enamel. Calcification of enamel begins at the DEJ. Okay, and the morphology of the DEJ is determined by the Bell stage. So the DEJ is not the same in every tooth. Sometimes the DEJ is too close. Okay, for example, where the dentin and the enamel meet, some of it is too close. Some of it, they have the tubules changing direction. Okay, and this is because the difference in development of the Bell stage. Okay, remember the Bell stage, that's why you have the histodifferentiation and morphodifferentiation. Okay, the oldest enamel is found at the DEJ underlying the cusp. That's another important point that you have to remember. Okay, where do you find the oldest enamel is at the DEJ underlying the cusp. Okay, and the stratum intermedia must be present for ameloblast to form enamel. So if you don't have any of the stratum intermedia, then you won't have any enamel forming. Okay, so very condensed 5 points here that you need to remember. Okay, points on the pulp. So the high-heeled points on the pulp, you have to know that all the stimuli to the pulp result in pain. Doesn't matter, okay? If you bite your tooth or you occlude your teeth too much, it feels pain. You put pressure on the pulp, it feels pain. You put hard cord, it's pain, okay? That's because the only nerve endings found in the pulp are free nerve endings. And free nerve endings, they only produce pain, okay? Free nerve endings in the pulp are found in the plexus of Rashkow. Okay, plexus of large cow has free nerve endings in the pulp. The pulp has both myelinated, okay, it has more myelinated than unmyelinated nerves, but it has both of them, myelinated and unmyelinated. The pulp myelinated fibers respond to sensory. They provide sensory afferent in dentinotubules. And the pulp unmarinated fibers provide as sympathetics to blood vessels of the pulp. The pulp has no proprioceptors. So the proprioception is the sensing the position of the body. Okay, so the pulp has no proprioception. So let's comparison, another high-heeled slide here. So comparison of young pulp versus aging dental pulp. Okay, so what are the differences between the young and the old or aging dental pulp? So young pulp has large apical foramen. It has more odontoblasts. It's very vascular and has more tissue fluids. So if something is very vascular, it means it delivers nutrients to the area faster. So you have more growth capability, you have more healing capability, you have higher chances of fighting infection. Okay. It has fewer fibrous elements. It lacks collateral circulation. Now, when you look at the aging pulp, okay, so young pulp has less fibrous elements. The aging pulp has increased fibrous elements, such as increased collagen fibers. It has increased denticles. These are denticles are also known as dental stones. Aging pulp also has decreased intercellular substance, meaning intercellular substance such as water or cells. So it has less of cells, it has less of water. Aging pulp has decreased number of undifferentiated mesenchymal cells, meaning the regeneration capability is less compared to the young pulp. Yeah, the aging pulp also has decreased pulp cavity due to secondary and tertiary dentin. So the pulp cavity is decreased because of the position of the secondary and tertiary, meaning these teeth have been been traumatized. There are people who brax, they are braxers, uh, eat very hard foods, exposed to caries. So these teeth and these pulps have been trying to protect themselves, so they deposit more. Uh, the teeth deposit more of secondary and tertiary dentin. Okay, so very simple slide, but very high yield material in comparison of young versus aging pulp, and this is very key in terms of cavity preparation and also in endodontic treatments. Okay, all right. So that's the end of this lecture here. Okay, and the next lecture is going to be we're going to start on the review of dental anatomy, meaning reviewing the actual tooth morphology, the curve of Wilson, the curve of Spee, and looking at the shapes, the height of contours, and the actual morphology.